Well, good morning, all you beautiful, brave hearts. Welcome to the BHN TV station. We're here to make sure that you're going to learn something today because that's what we love doing. Part of being sovereign and taking charge of our own life is always being a student and always being really ready and willing to learn. So today we have Dr. Server here to teach us all about calcium ion therapy and what are the many, many, many benefits it can give us. So Dr. Server, hello, how are you? And what are we going to be talking about today?
Hello, I'm doing okay and everything is going well. And today, again, we are going to learn something very important and very common. I guess nowadays, lots of people suffering from anxiety and depression. And we will going to look from different lens. What is this depression and anxiety and what we didn't think about this really important disease. And Sandra, if it's also okay with you, may I share my screen?
Absolutely, dear. Yes. So Dr. Dara Wolf feels like this is very common. People are so unwilling to go within and to learn about themselves that they've programmed themselves to disconnect and to, right? And sometimes that depression is simply your mind protecting you because it knows, hey, my person's been spinning on this for a while and they can't find any peace. So sometimes that depression is a protection measure, but it's certainly been based on that over time of that degeneration, sorry, of the brain. And so, yeah, so we want to teach them to come alive, to take that sovereignty back. And then the calcium ion therapy is going to help us with those physical consequences of that belief. So take it away, Dr. Server. We're really happy to learn from you today.
Thank you so much. And we will learn together. And really, this is a very interesting disease. And also, lots of healthcare professionals are suffering from this type of symptoms that is coming from anxiety and depression. Because when you have that type of symptoms, also your life will not going to make you powerful because you are feeling like you are losing your energy, just like fatigue. And I think many people think that anxiety and depression are just in the mind, but we have to know that it is not the full story. So we have to understand the whole condition, how we can change our life, what is happening inside our brain, but at the same time, also we have to think what is also going on inside the cell because that's the root cause, that's the reason why we are suffering anxiety and depression. So we will going to explore what is really going on inside the cell and how calcium ion therapy may help restore this calcium balance from the inside out. Yeah, I can't hear you, Sandra. Did you say something? Because I guess
There
mic
we
is,
go. Okay, sorry
yeah.
about that. I'm hitting too many buttons this morning. So let's talk about misconceptions.
Yeah, I guess misconceptions are very interesting, and that's the problem. I guess lots of time, not just about disease, we think that we know something and we are going with that way, which is making case worse. So just for example, let's look at this misconceptions about serotonin. All of us know that there is a connection between depression and serotonin, but if we say that low serotonin is the most important part and this is the whole story, then you are wrong. So serotonin is important, but another important part that we have to remember is we have to realize that there is also problem including serotonin level in our inside the cell. We will also focus on that. And also antidepressants work better when we look at the paperwork. Actually, what we mean is when we make research, when we look at the articles, we can see very good results. But in the real life, it is absolutely not working with that way. From the beginning, patient might feel that it is helping. Yes, that's good. It is going to help, but not always it is going to be in the same level with the paperwork. So we have to focus on the real life, how it is going to affect us. And when we look at the anxiety, we can see that it is not always psychological. It's also about electrical activity in neurons. So electrical activity is about calcium signaling. So we are also going to focus on that. So lots of time we might think that I know anxiety, I know breathing techniques, so it will going to solve my problem. Well, guess what? It is not going to be the solution. Yes, it can be helpful, but if we know something not 100% clear, then this is going to be a problem for us. It will bring us misconception about anxiety and depression. Sandra?
For sure. And then that's exactly what Dr. Darrowolf teaches. This is the fascinating correlation between the emotional and then the physical consequences of it, right? Those individual cells have enough intelligence to do their job and follow the program. So the solution can't be on one side of the fence or another. It does have to marry both of those together. And so thankfully you're in the right place with Doc of Detox because we teach about those belief systems. We definitely promote people to do the breath work and the meditation and the connecting with yourself. But here we're in Doc of Detox. We've also got a solution for the physical consequence.
Yeah, that's really important. So anxiety doesn't start in your thoughts. It often begins deep inside your cells. As we said, cell is very important. So when calcium level is dropped in nerve, so then we are going to realize that we will have lots of problem, including anxiety and including false alarm. So our body will not going to realize first the problem. Before the problem, our body is going to understand about chemical change. So when our signals are going to change, our brain will going to give us a result. So you have chemical change in your brain, and this is going to cause anxiety or depression. So we will feel the fatigue very deeply, even before coming very clear anxiety or depression. And Sandra, I don't know, I'm not quite sure about panic attack. Is it very common in your clinic? When I see this type of anxiety patients, sometimes it's a hidden panic attack, actually. They're coming with that, isn't it?
I think so, and I used to have a lot of panic attacks in my own life, and I think they can kind of you think it's the one that's going to be but I think we're dealing with such a high level of anxiety on an everyday basis. I think we're learning to live with a high level of anxiety so much that we are just on the verge of a panic attack all the time. So I think it is getting a little bit hidden. That's from my own personal observations and what was somewhat happening in my life, right? And when you try to speak to someone to go, okay, but let's just sit down and take a breath. And they're like, what are you talking about? This is just me. It's like, well, you're pretty wired right now, so you're not thinking clearly, and sometimes you can't even point out to them that they're not thinking clearly. So, no, I agree.
I guess it's also causing that problem. Yeah, we are not reading ourselves clearly. This is another huge problem. And we have to realize that this is not just mental reaction, it is also about voltage system. Again, it's about electrical activity and calcium balance. So if we restore this calcium flow, then we can solve this panic attack. And then even without any medication, we can have this result, which is very important because nowadays it is unfortunately very obvious. We can see lots of patient who is looking for medication. What do you have for my symptom? So they want to go with the symptomatic feel. It's perfectly understandable. They want to solve immediately problem, But when you work with that way, so you are going to forget the root cause. So medication for symptom, okay, for right now it will be fine, but by the time we are going to suffer from lots of also physical symptom like maybe muscle cramp, maybe different type of symptoms. So I guess sometimes they are coming as a physical symptom to you, Sandra, but I guess it is in our mind that we should also think about that. Is there any anxiety? Is there any feeling? Is there any issue that you think it is going to give us a result about depression?
Oh, sorry, what was that question again? Just repose that
Well,
question for me.
actually, sometimes I was saying patient may come with the symptom as a physical symptom, but we usually have to think that maybe this is also anxiety and depression because they both can cause these physical symptoms.
For sure. Yeah. And like I said, it's just so pervasive, and people have accepted this high level of anxiety because we're refusing to go within. So certainly it is people are just getting rigid, right? They're getting rigid in their beliefs, their body is becoming rigid. And absolutely it's when people can't relax, when they can't get into the parasympathetic, and they're always on that verge of fight, flight, or freeze. Where do I need to go? I'm always surveilling, right? And so just imagine that that's going to bring that anxiety, that's going to hold that acidic load in your tissues. And so yeah, it's going to bring back a whole plethora of different things happening.
Yeah. And because when we feel anxious, our muscles often get tight because our nerves are firing nonstop. So that's the one of the reason. So it is going to trigger our calcium signal. So that means our body is going to stay in the alert state, just like you said. So in this alarming state, we will stay. So it is going to cause lots of symptom alongside not becoming calm. So another dimension for panic attack and calcium flow inside our cell is going to again cause anxiety. So we have to help this calcium flow to put this calcium to the right place for relaxing our muscle. And this is going to be another solution with physical symptoms. So it's a actually win-win project. We will also win this war. So, are we really talking about depression, or do you think we are talking about cellular exhaustion?
Well, I think we're talking about both, but what do you think, Dr. Server?
Yeah, that's actually correct. This is both issue. And cellular problem is the main reason, but also we are seeing with the symptom of depression. So we can say cell is the reason, but when we look at the patient, we can see something deeper in our brain cells. That means we are losing our calcium rhythm. So in the mitochondria, we have tons of calcium that is helping us for producing energy. But because of this excessive calcium, we are not able to produce energy. That means with this depression, we are also going to have a fatigue. So this is going to be also energy issue. I guess in our life, for that reason, lots of time we can say that I also have mental fatigue. I also have physical fatigue because if we don't know the reason, then solving problem will be very hard. Even as a doctor, if we are not thinking about the mitochondria, then we will start to think different type of 100 type of disease, taking tons of tests, blood tests and MRI. You are just looking in your body, but we have to think very simple area such as mitochondria. So I guess sadness maybe it can be close to the depression. It is also have a connection with our physical activity. So when we say I'm feeling sad, yes, it is about emotion, But with this emotion, we are also going to cause lots of disease. So if you say that it's just sadness, it's just emotional, so I don't have to worry about that. I don't need to go to somewhere or get any help. But guess what? This is not going to cause any goodness. So you will see different type of disease because of this sadness. So don't say like this is just a sadness. This is the starting point for our imbalance of calcium.
An emotional disconnection, and can your physical body do what it's supposed to do when the overriding program is no, no, things are wrong, things are bad, I'm sad, right? Think of it as a spiral down, and your body is trying to get its instruction from those feelings. So it's just not going to work. The individual organs won't work, the hormones won't fire, nothing's going to happen.
That's right. And we have to immediately restore this mineral flow for solving this problem inside the cell. And not just we have to support the mind, we also have to help our cells for this restoration of calcium balance. So when we think about depression, we can see that serotonin is over there. So whenever we want to get results, probably you will consider about serotonin as a patient, but unfortunately, it is not going to help for your calcium to work. So what we should do is we have to know that boosting serotonin is only going to be a symptomatic help. It will not going to be a help for root cause. So for that reason, I guess lots of time when patient get medication or any type of drug, including antidepressants, they are not having good results. Just like mild depression is happening, but still it is not showing the exact result with complete remission. So they want to see the result, but with serotonin boost, it is only going to be a symptomatic way to try, not even a result. Do you also have this type of patient who is constantly for many years using serotonin antidepressant for your clinic? Is it very common?
Well, I don't know that I really speak to a lot of people that are depressed because they're not reaching out for help, right? They're not saying, "Hey, I'm ready to do something for self." So, I mean, part of the reason why we like to educate is maybe there's one brave heart in the family, and maybe if we can get them educated and they can realize, "Hey, my partner that's on depression medication, this is going to help them." So, we would maybe speak to the family members but not necessarily the person that's in that heavy depression. And that being said, Dr. Dara Wolf does talk to a plethora of people with all sorts of different issues and different problems for sure.
That's that's right. And one of the another I think dimension is sleep problem. They have very poor sleep. It is blocking also their emotional state. So it should be very hard. It's definitely clear that depression will get worse. So even they are not going to realize that they have depression, but they might only think that it is just poor sleep, but they are suffering from depression. We have to realize that, and we have to also fix calcium flow in this type of patient with sleep disorder. So we have to restore our brain natural nighttime recovery system for helping this poor sleep.
Perfect.
And I guess sleep is kind of secret symptom for depression. It is also affecting our mood. So for that reason, when they come, I usually ask them, how is your sleep? Even it is not very clear, it can give us very good clue about their emotional state. And also, when we think about gut feeling, it is having very good connection with our emotional state. We can, I guess you also say that as a second brain, God is second brain for us. It is very sensitive area. When we have hard time, suddenly we may feel pain in our stomach. It is, I guess, don't you think that it is shouldn't be incidents? It is definitely connection with the nerve vagus. We have very clear connection between brain and our small intestine and our gut. I guess when patients feel and realize that, they can hear their voice from their body, whatever is trying to say us.
Yeah, we definitely teach about that gut flora that so many people are talking about, right? That small and large intestine, that gut flora, that bacterial level, right? We're getting more bad bacteria than good bacteria. So the messages going to the brain, the gut feelings come from the brain are, oh, I'm in trouble. Oh, I'm actually angry. Oh, right? And so if we can get that large intestine, if we can get that colon working much better, then you're going to be getting much better gut feelings. You're going to have a much better connection and you're going to be able to function a lot better for sure.
That's right. And when calcium signaling in your gut is off, so then it can create nerve feeling even before your brain reacts. This is really powerful. It is ready to react. So definitely they are right to say this is second brain. So it is understandable. So when we are calming from the anxiety, that means also our gut is getting better. It has very tight connection between brain and gut. So let's also look at why they are trying to help their patient with therapy. So talking, yes, it is very important. I'm not saying that it is not necessary. It is very powerful. But with talking therapy, it is going to be helpful support to your health, but it is not going to touch your mineral. There is no connection with that. So we have to touch our minerals, especially we have to touch our calcium. If we don't do that, our emotional progress will not going to improve. That's for sure. So we have to calm our calcium level. If it's low, we have to increase wherever is necessary. Or if calcium level is high, then we have to lower that. Lots of time, inactive form of calcium in our body is just hanging around, and this is causing tons of problem with this imbalance of calcium. So we have to help for this imbalance in calcium.
Right. We are electromagnetic beings. If the chemical transactions can happen, talk away, but that person's going to keep coming up with the same answers, the same answer, and the same answer. So if we can get those electrical connections, those minerals to start interacting, then we can make some progress.
That's right. And we can understand this progress is getting better when we try to help our patient. And uh, the cellular level is always think for lots of people might think that this is not important, but also for anxiety and depression, this is very important because this is electrical and mineral based problem. If we think about anxiety, this mineral based problem is the main problem. So when we take different type of blood tests, including CBC, maybe biochemistry, they are going to miss calcium imbalance. So with looking at this test is going to show maybe different result, but it will not going to show us imbalance. So it will not going to help for healing from this deep imbalance. So when we look at the picture, we can see there is lots of things is going on, and we don't have to worry about that. What we should focus is our focus should be calcium. So we have lots of gate that is ready to help our cells for taking calcium. But if we have problem with amount of calcium, then these gates are going to have a problem. So when we have this excessive movement of calcium, then our cell will not going to work properly. That means it is going to have swelling problem, also inflammation, and our cells will not going to be able to clean waste, because when we have any type of reaction or any mechanism, metabolic pathway, after this type of reactions, we are going to have extra elements product that is not necessary for cells. So cleaning process is very important inside the cell. So if it's not working properly, then we will going to have issue with this excessive extra product that is going to cause inflammation, that is going to cause also neurodegenerative disease, not just anxiety, not just depression. When
Perfect.
we, yeah, when we come to this slide, we can see there is a little fella, it's called mitochondria. So mitochondria is very good, one of my friend for energy, but poor mitochondria is full with calcium. So we have to solve this problem. This is calcium that is sitting over there, but for energy, if we don't remove this excessive calcium with active ionic calcium, then this mitochondria will be useless. Inside the cell, it is ready to work for producing energy. It is ready to help for restoring calcium signaling, but without inappropriate calcium, with calcium supplement, with inactive form of calcium, instead of helping ourselves, we are causing lots of trouble. So let's say you got 500 ml, 500 milligram calcium, and it will come inside the cell. And when this calcium came to inside the cell, that's just problem. That's just going to be another excessive amount of calcium. That means we are not going to solve anxiety. We have to restore this calcium. So another organelle, ER, is waiting over there. This is just a name, but these two organelle are waiting for helping calcium. Only if we give active ionic calcium. If active ionic calcium came to here with the receptor, with the detection, our body immediately realized that we have excessive calcium, and then it will take calcium from here to the bone, which is the solution, which is the salvation for this calcium dysregulation. So calcium ion therapy is working with that way, removing calcium from unwanted area to bone.
So we can, and one thought that just occurred to me, sometimes when we talk about calcifications, we think, oh, it's going to make a bump or it's going to make this or that. What we're talking about here is just small amounts. I mean, small amounts to the way we would think in our head. It's just calcifying the mitochondria so it can't function, right? So it's not like it's calcified over and it's covered. It's just can't do its job. So this concept of things being calcified, I think in my head, I just always think about lumps and bumps, right? Oh, well, I don't feel the calcification. This is happening on a cellular level, right? So that image just helped me understand that on a finer cellular level.
Yeah, I guess it would be my desire if we would feel this calcification, it would be very good for us, because as a silent thief, osteoporosis is a huge problem because they are not feeling anything but I'm sorry, calcification is still over there inside the cell, still it is waiting for trouble. So if we would feel it, then we would think that I'm going to help for this calcification. And I guess this is not very commonly known, but the worst calcification is intracellular. Inside the cell calcification is the worst one because it is not easy to remove that. Then solution is going to be very late. We have to work with that way. So If it's okay also with you, Sandra, I would like to explain a little bit real story, real cases.
Absolutely, yes.
Thank you. So this patient was struggling from joint pain and also depression. I think this is very important point that we should realize that. Just imagine that patient is suffering from not just joint pain, diabetes, maybe hypertension. By the time, yes, you are getting your medication with exercise, you are trying to help yourself, but one thing is missing. This is going to cause lots of burden to your mind. Mentally, you are tired because of getting medication, because of going doctor. Even visiting your doctor can be anxiety for us because we will learn something that is not good for us. So bad news with physical, with systemic symptoms, we are bringing depression and also anxiety, just like this case. So, arthritis, joint pain is coming with the depression. So, we have to help also joint pain, arthritis alongside depression. So this arthritis was causing pain in knees and knuckles. So, I guess nothing was helping for this patient for lasting relief. They were looking for tons of different treatment, including natural medicine, conventional treatment, but result was not good. After when this patient started using calcium ion therapy, they just immediately noticed it was a big change with only 10 days. I guess it's the fastest action I can see. Pain and swelling was going down. Patient was feeling very comfortable. And also, her husband was very happy because it was the first time that they didn't need to have any medication, any painkiller. Heating pad was not necessary. So that night was, I guess, very happy for this husband to see that his wife is getting better. So it is very hard with pain and also feeling depression. Also, I guess, exhaustion that you might think that I'm not getting result, and then suddenly getting calcium ion therapy, and patient had this tremendous result.
Right. Let's read the statement though. It's quite fascinating. I had terrible pain due to knuckle and knee arthritis. Every night I put heating pads to alleviate the pain, but the continuing pain made the quality of my life so miserable, and I came down with depression. Then one of my caring friends recommended CIT. Being desperate after many futile attempts with medicines and supplements, I decided to give it another chance, give another product another chance, right? Remarkably, after taking CIT for just 10 days, both the pain and the swelling were reduced significantly. I was taken aback. My husband, who helped me with the heating pads every night, was surprised at the powerful effects of CIT, and he is finally free from the task as I am also from suffering.
It's really hard. I guess result was very impressive for their family. Usually, not just for Alzheimer, also for this type of symptoms, especially depression, we have to realize that your disease is not contagious, but it is going to affect your family. Just we can imagine that your friend or your sister is suffering from depression, and definitely you will going to have this symptom because you can see that she is suffering, and also it is kind of sharing symptom. So we are not just helping ourselves, we are also helping to our family for these huge symptoms. And this is, of course, not for only adult patient, also with kids, but especially nowadays, I guess this is because of the Wi-Fi, because of using cell phone and different type of social media. They are just constantly uh, bombing dopamine. So that's the one of the reason they are not feeling happy. No matter what you give, your kids, they are just keep looking for something different. So depression is coming with that type of, I guess, reason. So let's look at this case. This case was 15-year-old, and this girl was suffering from autism and also depression. So they were diagnosed when she was 2 years old. So it should be very long period of time, difficulties, also behavioral problem and sensory issues was hard for this patient, and also patient need to go to special school for her needs. It wasn't, I guess, able for them to go normal school, which is another huge problem. So in 2019, when they come to doctor, they were looking for support, and it should be very hard to see patient is isolating herself in her room. So this could be very tough symptom also for doctor.
So let's go through this medical and personal timeline. This is fascinating. August 20, so July 19 consultation, August 2019 started calcium therapy. October was able to study at home with a home teacher. November, attention span increased and could have 4 lessons a day. January, 2020, willing to do subjects she didn't like before, so her mind is able to expand and start considering new things. March, wrote a letter to her favorite YouTuber, so this is great self-expression. This is incredible. July, started having longer conversations with her teachers, deeper understanding of things, more curiosity. September was able to attend a special event without tantrums. And then more results in February of 2021, attended an online school. During that whole year of 2021, notable increases of more and more cognition and social abilities. And then March 2022, taking part in secondary school examinations in a normal school setting stream. So that's amazing. This girl was diagnosed at 2 years old.
Yeah. And
Yeah.
did you know that she also passed this national exam? I think,
Amazing, amazing, amazing.
yeah.
Well, Dr. Server, thank you very much. You always end up enlightening us and showing us those fine little logical bits that maybe we're not understanding. I think some people in the because we do our very best to educate people really well about the calcium ionic therapy. They're loving the amount of information we can share, and they're loving these weekly shows. So thank you so much for being there. And I'm just going to make sure that everybody's really up to date with what all's going on in the world of DACA Detox. But I salute you. I thank you for your attention to detail and your heart. You are always, you're very family oriented. So you really feel the consequences that the family experiences. So I really appreciate your heart, Dr. Server. Thank you so much for being here. Thanks for being on the team because you help us to educate people so much better about the calcium ionic therapy. So thank you very much for being there.
Sandra, I really would like to say thank you so much for this great opportunity because I know that Dr. Wolf has lots of patients, so he has lots of different type of patient with suffering from different type of disease, and they are willing to understand disease meaning and they want to help themselves. So this is, I guess, one of the most important thing. So it is really making me happy to help for all these patients to understand their condition, which is the most important area to help ourselves. So really, thank you very much, Sandra. I hope we will have another good topic with you.
Absolutely. Okay. Well, you take care. I'd love to meet with you next time.
Thank you so
Okay, Doc of Detoxers, let's nope, maybe I need to do that a little bit different here. Sorry, Rafa. What you can see on the screen is I guess just me at the moment. So pardon me, let me go in. I'm learning how to share my slides. There we go. Does that help, Rafa? I think so. And let's just size this just a little bit. Oops. Sorry, guys. A little bit awkward still here. Okay, there we go. Now let's find my Zoom room. Okay, there we are. Now we're back. Maybe and maybe not. Okay, I think I'm screwing things up today, Rafa. Anyways, if you want to do it, you can just stop that if you want. Um, and let's make this a little bit bigger. Okay, here is all the different choices for the that we have for you: the Amerigen, Alzagen, Dentagen, Cartigen, Megagen, Ozu Junior. Head to bhnapp.com for more information and head to our store, store.docofdetox.com, because you can hit the calcium ion therapy link, watch a whole bunch of videos, and then give us a call to make that first purchase for your calcium ionic therapy. Currently in the store, we have the, here we are. Okay, I got the slides here. Okay, I misunderstood. I thought, Rafa, you were doing it. Okay, that's fine. So currently in the store is the spring into summer cleansing and weight loss sale, up to 40% off. So dive in there. That's going to be until Sunday night, midnight. The next live collaboration coming up is going to be Gold Care Live event, a BHN TV special world event by Dr. Dana Granberg-Neal. There we go. Okay, thank you. Dana Granberg-Neal, Dr. Simone Gold, Dr. Gerald Wolf, and 18 world healing leaders. Sunday, July 13th is going to be live on all the social media channels, and then 2 Q&As that you can sign up for to be a part of so that you can interact directly with Dr. Gerald Wolf. Is available at bhnuniversity.com. Go there and sign up, and you're going to be able to attend 2 Q&As, Monday Q&A 12 p.m. to 2 p.m., July 14th, Tuesday evening Q&A 7 p.m. to 10 p.m. Now, these high-level collaborations are fabulous, but we are just wondering, is Facebook really going to allow us to be out there and getting this high-level information out on a consistent basis? We don't know, right? So our information is free health and healing for all humans. Our message is for the world, so we want to make sure that that message never stops being sent out to you. So Dr. Darwolf has already thought about this ahead of time. He's already invested hundreds of thousands of dollars into an app. So please get to the app so that we can make sure that you never stop having this connection with the education that we love giving you. Go to bhnapp.com. You can download it on your phone, your device, your laptop. And within the app, there is Track Your Perfect Day. Am I doing it correctly? Maybe, maybe not. Okay. Within the app, there is Track Your Perfect Day. There is News and Events. There is the New World Practitioner Map. There is the Evolve tab, which is the world's largest free online library of videos, guides, and audios. Now, that practitioner map is your connection to find the closest practitioner to you, hopefully one that has a Power Pack clinic. Nonetheless, they'll be able to do the Wolf non-surgical for you. The Connect tab is basically your chat function. Let's connect with other Bravehearts all around the globe. The Perfect Match is fun. You have to watch the Braveheart Intelligence video series, and then you can go in there and say, hey, I want this kind of mate, and let's see. And we just use that Braveheart Intelligence masterclass as a base of, hey, we all agree somewhat, even if you don't agree with absolutely every single little bit of it, but we're all on the same page. And then you can go in and put your preferences for a match. The mindful moment reminder is a beautiful Tibetan bell to get you back into that present moment, to help you say, oh yes, my power is in the present moment, right? So go to bhnapp.com and unleash your personal roar. Okay, Dr. Sage Wolf is going to be heading to St. Louis, Missouri. He's going to be doing Wolf non-surgical, cell sonic regeneration, cardio med bed, thermographies, and full consultations with those thermographies. You're going to call Tim to book 479-215-9592. And if you need to speak directly, bed, thermographies, and full consultations with those thermographies, you're going to call Tim to book 479-215. And if you need Sage Wolf 50 5673. Then he's going to head to Montreal, or sorry, Tim is July 6th to July 15th. Then August 23rd to September 1st, he's going to be heading to Montreal, Quebec. You're going to call Christian de Book 483-929-0997. And again, that is August 23rd to September 1st. Here is the rest of the course dates. Calgary, the next date coming up is Friday, June 27th to June 29th for the women's pelvic course. Then the whole course load is going to be in Ixtapa, Mexico, starting October 29th, ending November 23rd. Another course load in January 29th to February 27th, and then Los Angeles for the full set. Head to bhnuniversity.com for course information and also for your financing information. US people can get financing for the course load as well. Something exciting that is coming up, Dr. Dara Wolf is going to be attending the 2026 Conscious Life Expo in LA. Come see the Transformational Healing Universe booth for live Wolf non-surgical cell sonic regeneration treatments. So head to consciouslifeexpo.com for more information. So everything here that we do for you is so that you can go from patient to healer, from victim to Braveheart. Currently, we've got a DoD 5-star healing and training center in beautiful Ixtapa, Mexico, and soon in 2026, we're going to be opening one in St. Cloud, Florida. So that's extremely exciting. We are on all of the most popular social media sites: Facebook, X, Instagram, YouTube, Rumble, Telegram, and BitChute. And we love to teach, so we've got these audios. We've got audios available on Spreaker, Spotify, Zeeker, iHeartRadio, Podcast Addict, Podchaser, Google Podcasts, Amazon Music, Audible, and BHN TV station for all those life-changing, life-saving podcasts. We've got Doc of Detox fulfillment centers, the US, Canada, and Australia. So head to shopdodnow.com to get your hands on these products. Become an affiliate partner. We'd love it for people to join with us because we know word of mouth is the best. Your personal, authentic testimonies are the absolute best, right? So sign up at docofdetoxpartner.com and earn commissions on referrals to the Doc of Detox store. Now, if you're a health professional and you're already selling products, then give Dr. Dara Wolf a call. He'd love for you to join in on the wholesale program. Call him directly at 469-861-9454 or on the toll-free line 855-900-4544, extension 5. Also, you can email the team at office.docofdetox@gmail.com. Now, we love educating people about DoD Power Pack clinics. This is one of the things that you're going to find in the app when you click on practitioner map. But if you're interested in operating a Power Pack clinic, we've got lots of information for you. Go to dodpowerpack.com. Check out purchasing the cell sonic regeneration and the cardio med bed. And if you do, you will get a free 23 professional training personally done by Dr. Dara Wolf and Dr. Sage Wolf. Now, financing is available for this as well. So dodpowerpack.com for the information. You're also going to see a tab there that's going to say apply for financing, and also financing available for the course load, just like I mentioned before. Okay, let's keep on going. We've got the DoD 5-star healing and training center. That's what it looks like. And you can head down there for treatments. If you can't get down there for treatments or for training, then Dr. Sage Wolf can come to you for personal certifications and trainings. Give Dr. Dara Wolf a call at the toll-free extension 5 or the direct line at 469-861-9454. Consultations are available. Oh, sorry, I missed that. Yep. The courses, the prices of the course load is 9 days, 3,995. 12 days for the Wolf non-surgical at 4,900. The New World Practitioner, 21 days is the whole thing, is both of them all together for 8,000. And then the 3-day masterclass for the pelvic restoration and disease prevention for ladies only. So go to bhnuniversity.com, be here now, show up for yourself, and unleash your healing. Financing is available. We chatted about that. Let's go to Perfect Day Consultations. Book your consultation with Dr. Daryl Wolf for $350. You get an hour to an hour and a half of his time, his expertise, his ability to crack that coconut. So give his assistant a call at 855-900-4544, extension 1. Our direct line at 250-980-0554. And you can book your personal consultation with a qualified practitioner like myself, lifetime telephone support, New World Master Practitioner, $150. And check out that page, perfectdayconsultation.com. I believe they're still on sale for $95. Okay, if you love Doc Detox, you love wearing your swag, we've got sweatshirts, we've got t-shirts, hoodies, we've got hats, and look at this, we've also got water jugs as well, so that you can be showing people the different slogans. It's so much fun. Let's see, let's go to the Perfect Day Guide. It's free to download. You're going to get all this information that we've talked about put together in a beautiful document. The online version is great for doing a word search. And then for people who like the printed version, go to the store and get that purchased for $95. Healthy to 100 is also available on the same link, the pdgfree.com. You can download both of those documents, and you can also purchase both of these documents in the store. Now, everything that we've done for you today is to help you connect with the fact that the only permanent healthcare is your self-care. The only permanent love is your self-love. So connect with that, learn to rise to your full potential. Let's fly. Let's first love yourself. So as we come together, we are stronger, we rise together. So head to the bhnuniversity.com, head to the bhnapp.com and get connected. And just remember how important that app is, because we don't believe we're going to be allowed to be on Facebook very much longer. So let's take a moment, let's connect with that Braveheart oath. Thank you for being there. It's an absolute pleasure to be with you and to help communicate these ideas and ask those questions of these people, and make sure we can get the goods and get all of that information and continue to keep learning, right? So the Braveheart oath, let's take a breath. Let's put our hand on our heart. I am love. I am healed. I am Braveheart. Today and every day, from the moment I rise until I gently close my eyes, I will always trust, honor, respect, protect, forgive, and totally love myself first and foremost before anyone else or anything else. So help me God, because I am, I can, I am love, I'm healed, I am Braveheart. Well, I'm all in for me. I trust you're all in for you. 3, 2, 1. We got this.